get the best out of it. It would be great if you guys get your hands dirty and start working on some pitch deck. So right after this, we're going to have kind of a small group session with some of our
So we have, roughly speaking, about 15 mentors, and we are going to create breakout groups for you guys, like potentially 3 people at each group. And then this group is going to go through stages of preparing a pitch deck. So in the end of this, let's say 40 minutes, we are going to have one pitch deck that 3 of the members of the workshop and one mentor together prepare. And in the last 20 minutes, we are going to see some of these pitches, the ones that want to present and get feedback. And then altogether, we are going to provide feedback for those presentations. And in the end, we hope that this whole process is going to help us to utilize generative AI and build effective pitch decks that are going to represent our idea, which problem we are attacking, our solution, the market potential, competitor analysis, financial plans, marketing strategy, and our call to action. So for that, let's wait for Belen to get the control of the breakout rooms. Belen, are we ready? Okay. And in the meantime, if there are some questions, feel free to bring them to the table. Okay, if there are no questions, Zelala, while we are doing the setup, how about going over one of our pitch decks? Like, at CoreDev, we have 5 projects which are going to launch soon. Some of them, they are about to finish beta testing, and we see very good engagement. Like, if there are any good ones that you want to show us, actually go over one CoreDev pitch deck while we are waiting for the setup.
Yeah, definitely, Emre. All right. So give me some time to open it up and then I'll share my screen.
Thank you. And in the meantime, I can give information to our attendees about the core dev projects at A2SV. So A2SV is not just a non-profit tech academy. We are also building digital projects for Africa. And in that regard, like right now, 1.5 years ago, we have initiated our core dev unit. And In the first generation of core dev projects, we have five of them. So these are trying to solve different challenges in our communities. ADOT is aiming to help pregnant women in Africa to learn more how to take care of their incoming babies better. And this is utilizing generative AI. This is connecting doctors with their uh, yes, like this one. We have four more. And now, Belen actually let me know that we are ready to create the breakout rooms. So we are going ahead and doing that. And Zelalam, until the setup finishes, until we let our people go, would you like to quick go over one successful pitch deck?
Yeah, sure. Over adults pitch deck. So as Emre mentioned, this is our one of our core dev projects. So I hope you can all see my screen. Can you see my screen? Yeah, all good.
Yes, yes.
All right. So for adults, so first of all, we have without telling you about adults, let me go over the pitch deck and see how much you understand and put yourself in the position of a potential investor or a client and see what you understand from this pitch deck. So the very first slide is your title slide, and you have the company name, our logo, and our tagline, right? So empowering mothers on their pregnancy journey. That's our tagline. So we move on. So here we've added a mission slide, and this is because we are mainly a mission focused and impact focused project. So this is why we added this slide. So it states ending preventable maternal deaths in Africa by connecting mothers with medical professionals and essential resources. So here we've given our mission. It hopefully relates with Africans. It also has mothers and our doctors, so we really relate to it. And then we start with our problems. So what problem are we trying to solve? So we've identified three problems. The first is lack of culturally tailored, locally understood motherhood information. Our second problem is difficulty in the monitoring pregnancy journey. Our third problem is insufficient support for mothers. As you all can see, these are clear, very simple. They are divided into three distinct problems. So moving on, now that we've stated our problem, we also help our audience see the market potential for this. So as you can see, the very first is the trend. So what we have until now is we have 46 million yearly births in Africa. We have 287 million mobile users in Africa, and we have $51 billion market cap in the global femtech industry. So this is the trend. It's what we've seen until now. So what does the growth potential look like? So in the year 2030, that's a year that we've chosen. As I've said before, you can choose based on your project. It can be in the next 10 years, 5 years. It depends. So in the next, 6 years from now, yearly births in Africa will be 50.05 million. Mobile users will be 393 million. And the market cap and the global femtech industry will be $103 billion. So as you all can see, there is a clear growth potential in these projections. So that lets our audience and our investors see that there is in fact a lot of room for growth. So this is what they want to see. And moving on, we have our solution. So we've clearly stated the problems, and now we're providing a solution for that. And our solution directly correlates with the problem. And let's see what the solution says. So, a platform combining medical and tech expertise to offer pregnancy monitoring, local information, and community for African mothers. So this solution statement covers all the problem statements that we've listed before. We also have a demo or yeah, a preview of our solution. So it's a mobile app, and this is the homepage of the adult app. So moving on, we've also added a value proposition slide. So a value proposition is different from solution. So what is the difference between these two? For example, let me give you an idea. So let's say there's okay. So let's say you all have smartphones, right? So in your smartphones, there's a company that is addressing the problem of very short battery lives. So so for that, they're providing a solution by having a better battery that can go for a long period of time without needing to charge. So that is their solution. But what is the value for this? So the value is perhaps they can have you relate your adventure, to your weekly or monthly adventures where you go out hiking, and you do not need to charge it. You do not need to return back home. You might escape danger or an emergency because of your longer battery life. So it provides value like this. Having a longer battery life has different values like this. So the solution is the better battery itself, but the value could be so many different things. So we've added our value proposition here. So next, we also have our go-to-market strategy. So our marketing strategy here is first to partner with hospitals and medical institutions. Second, to onboard doctors on Idols platform, and third is to onboard. It's for doctors to onboard their patients. Excuse me. All right. Thanks. All right. So we have three clear marketing strategies for this. So we have tried to be different to stand out. We aren't saying some generic things like we'll be having an online presence on Instagram and Facebook, because that's, as I've told you, it's generic. It's what everyone does. But partnering with hospitals, onboarding doctors onto our platform, that's different, and that's how we try to market our product. All right, so moving on, we have our revenue streams, or these are our business models. So we've proposed four different types. So the first is advertisement. So for advertisement, we'll connect vendors with customers by promoting products like maternity wear, baby toys, and other health supplements. So when we do this, we provide an advertisement on the homepage, on different pages on our marketplace. So ad revenue can be a good source for different apps, especially if it's online based. Our second stream is marketplace. So this is where we feature different products that are related to maternity, health, and hygiene. So different vendors can come to our platform and they'll have a marketplace, and our target market are mothers. So they'll have direct connection to the target market that they are looking for, which provides them value. Um, so the third option that we put is a hospital service fee. So we enable doctor-patient communication and charge hospitals for the service. So a hospital can market itself by saying that they'll enable doctor-patient communication in the comfort of their home. So that's additional value that the hospital adds for their patients. So the patients are can pay more for this service. So that's how we target the hospital through this revenue stream. And finally, premium subscription. There's also a common method for most online platforms. So we provide ad-free browsing, medical consultation, and personalized guidance by medical professionals whenever you subscribe for a premium model or a premium subscription. So these are our revenue streams. They're very clear, and there are four methods that we put out. So our competitor analysis is the next slide. So here we've identified our competitors in Africa and also globally. So we've listed some features. So in these features, we've tried to show how Ado stands out. So let's take Zero Mother's Day for example. So it's a well-known app in Africa, but comparing it to adults, it doesn't have the pregnancy monitoring tools, it doesn't have the local language availability, and it doesn't provide communication with doctors. So this clearly makes us stand out. And there's also the My Pregnancy Journey app, which doesn't provide communication with doctors, which we're using to our advantage. So you can create similar tables like this in order to show how you have a competitive advantage over your alternates. So moving on, we have the our team slide. So in our team, we have quite a bit. We have 10 members here, which includes medical doctors. So you can see how adding medical doctors really works to our advantage because it gives us credibility since we're working on a medical app intended for mothers, and we have two medical doctors in our team. We also have our project lead, our backend developer, our product manager, mobile developer, web. So it shows that we have a holistic team which comprises of different departments. And moving on, we have our advisors slide. So adding our advisors, our notable advisors, will help in gaining the trust of our potential investors and our clients. So it shows them that we have a technical advisor, our business advisor, product advisor. But not only that, it shows the experience that our advisors have. Because if we state that they are our advisors, they must be significant in one way or another, right? So they must have a long-standing career, or they should have very good achievements in their sector. So here we also show, for example, let's take Summit. He's our technical advisor. He is a senior machine learning scientist at Overjet. So you can see how this adds to our platform. And we can take Emre Varol. He's our business advisor, and he's the founder and CEO at A2SV. He's an ex-Google Palantir liftoff ML engineer. So we can clearly see his accomplishments, and it will be wise for us to take advice from such an experienced person. And finally, Salman Kadrioglu, who's our product advisor. He is a chief product officer at Parity, ex-Meta technical program manager. So you can see when we have advisors like this, it's most likely that our team is going to succeed. And this is what our potential financiers will want to see. And finally, we're finishing. This will be our very last slide. It's our call to action slide. So here we do not have a clear investment ask because that's not the intention of this speech deck. As I've stated in my previous workshop, there are different ways. I mean, there are different reasons to preparing a pitch deck. It could be for partnership, mentorship, investment, and there could be other reasons as well. So here we've finished with our tagline. We have our company name and logo, and we also have our contact us. So here we have our email, our website, link to our link tree, QR code to our link tree, our address, phone number, and we tell them that we're backed by Google and under A2SV. So this is it for adults, and this is what pitch deck should look like. Thank you all for listening. If you have any questions, you can raise your hand.
Thank you very much, Selena, for the presentation. And team, now it is time to jump into the breakout rooms. I think everybody at the moment should have received the invitation. So please click join and jump into breakout rooms. And I will be also doing the same thing. And with one of the groups, we are going to continue the practice time. And together, we are going to prepare pitch deck content with ChatGPT. All right. Thank you, team. Let's do that.
Okay, so hello guys. The breakout rooms are in session. So please join your assigned breakout rooms immediately.
Currently in software engineering at Deloitte. I'm glad to be here. I'm ready to interpret what I'm going to learn from my future.
Nice. Thank you very much, Peter. Good luck. All right. Next step, Terian, 1-0. Terian, please introduce yourself to us. Terian, you are muted. All right, maybe like a number, yeah. If it's not convenient, feel free to write a short introduction on the chat window. And now, actually, we received Namaria's one. So, Namaria is from Malawi, and from University of Malawi, and majoring in information systems, and graduating this year. So, in the final year. Thank you very much, Namaria. Nice to meet you. All right, team. Let's continue our introductions with Kenna. Kenna Belay. Yes. Could you please introduce yourself to us? Thank you very much, Kenna. Team, indeed, Kenna is part of our social media team, and he is helping us broadcast this event. Right now, our room is broadcasted, and our watchers from YouTube, they can also see how we are approaching this problem. Cool. So if we are ready, team, I would love to share my screen, and in the meantime, ask you guys. So which idea we should work on? So let's get some idea suggestions. And the idea suggestions are open for everybody. Arman, would you like to kick us off? Do you have any ideas that you want us to go over?
Um, I'll ask maybe some time to think about that. Maybe we can continue with other if I have something I will come with.
Mhm. And Tim, in the meantime, maybe I can give you a bit of information for AfroChat. So AfroChat is our generative AI interface for Africa. Like as you know, but there are many great machine learning models, large LLMs, large language models that are coming out and that are super helpful for everybody. There is a lot that we can do with generative AI. It can help with so many things, including pitch deck preparation. And what AfroChat does, AfroChat allows you to work with whichever model you want to work with. So in one interface, you have access to all available free models. And the premium version is also being developed. Hopefully soon that will be available. But at the moment, if you want to try OpenAI's model, try Facebook's model, Google's model, Cloudy from Anthropic, all these models are available here. That's why we wanted to do this demonstration with AfroChat. And this is also one of A2SV projects, by the way. It's for free. All the Africans can use to take advantage of generative AI. Yes. So now, before we start, team, like we also prepared a prompt that we can use to share the content of the pitch deck. Actually, there's even a better one. There's a prompt that we have prepared, which actually gives a bit of an information for the structure we have for pitch deck. So let's go over it all together. So this is a message for our model here, so that it's going to help us in the best way in this workshop task. Hello, GPT. We are participating in a workshop to help African tech talent create compelling pitch decks for innovative projects. As mentors, our goal is to guide students through each section of their pitch deck, ensuring clarity, impact, and professionalism. Let's start by understanding the structure and purpose of a pitch deck. Please provide a brief overview of what each section of a pitch deck should include, focusing on the following: cover slide, problem, solution, market opportunity, business model, marketing and sales strategy, competitive analysis, team, financials, milestones, and projection. This will help us set the foundation for our breakout sessions. Thank you. And the breakdown for matters to use. So for the cover slide, we will use the ChatGPT to generate a compelling title and tagline. Then we are going to define the problem with the help of ChatGPT. Solution, market opportunity, business model, marketing and sales strategy, competitive analysis, team financials, milestones, and call to action. So this is the task. Like right now, we don't have yet this part of it because the prompt is not for GPT. So I'm going to go ahead and delete the mentor instructions. Yes. Now, I want you to ask questions to understand our solution idea, digital product better. Ask one question at a time. Because one of the most powerful things that you can do with generative AI is helping it to understand the problem better. And in this case, the problem is our idea, right? It needs to understand our idea better so that it can help us in the best way. So allowing it to ask questions is always good. But when you don't limit, it asks so many questions at once. So that's why I said, okay, let's go with one session at a time. So what specific problem or challenge we are trying to address? Now we are open for ideas. Um, Armel, do you have any idea that you want to bring for us to prepare pitch deck content?
Yeah, maybe. This is quite close to what was presented in the demonstration. Let's say like a mobile app, for instance, in medical sector to help people in not deserved area, like people who do not have access to healthcare, to use that app, for instance, to schedule like a meeting with a doctor or something like that, instead of going directly to the hospital, because there are some villages, for instance, who are very far from the closest hospital, so that instead of going there, they can schedule a meeting with a doctor from the house, and do a consultation or something like that before going to the hospital, because maybe they are in emergency or something like that. This is not really elaborate, but yeah, that's the idea I'm gonna have.
Got you. So, like, I'm trying to get problem from that, and this is what I come up with. In some areas of Africa, access to hospitals and medical facilities is limited. It is difficult to get consultation for people who live in those areas.
Yeah,
Does that capture the problem we are trying to attack, right?
yeah,
Like the
yeah,
general
exactly.
problem. Perfect. Okay, it's actually yes. Okay. So next, now I think we are focusing on solution. So how are we going to provide a digital solution, or what kind of solution you think? Maybe not digital. It's your idea, right? And how are we going to solve this problem? What can we do about this? How are we going to improve access to medical consultation for people who are living in those areas?
So, from my point of view, there are two ways. Actually, the first one will be to schedule like a virtual meeting with a doctor, but the main concern here will be the fact that people in those areas won't have access to internet. And then the second thing comes up, uh, installing like uh, internet access for all those people so that they can schedule consultation using a public phone with a doctor.
However, those people usually don't have internet
Yes,
access. Therefore, could you please tell that part again? Like you mentioned about public phones, right? So how are we
like
going to get them connected
yeah,
to the internet?
like having an
Can you give
access
us
point,
more?
a public access point, so that people can come at this at that place and use the public phone to schedule appointment with doctor.
Public those access points to have internet access and um, schedule medical appointments. Mhm. So, like, that's capture the whole idea. Like you mentioned, maybe two stages. Like I started numbering, or is there another solution that you want to mention now?
Yeah, the second solution will be to have within the app have like a whole section dedicated to prediction, because when the user recreates his account and so forth, there will be a step in which will fill the user detail, like um, the current information about his health, uh, what he can eat and what he can't, like detailed medical information, so that we can predict exactly, not perfectly, but implement a machine learning model to predict which disease he can catch and what are the symptoms, so that if something happen, he can go through those and see if the symptom he currently have is close to one of the predicted disease.
Offline manners. Like basically, we try to do our best utilizing machine learning here, so that we want to help them in the offline situation, right? Like let's say they are home, there is no internet, and we want the app still to provide some medical help if it can.
Yes.
Is this okay? And this can be like making diagnosis or providing medical suggestions, right?
Yeah,
And in the
perfect.
future, maybe it can even get further and even give maybe nutrition suggestions, etc. Right? But the important part is this has to work in an offline manner, right?
Yeah, sure.
Okay. Then let's continue. Yes, thank you for sharing those details. It's clear that your solution aims to address the challenge of limited access to medical consultations in areas with connectivity issues through remote appointment scheduling and offline medical assistance within the app. To delve into deeper your solution, could you elaborate on how you plan to ensure the reliability and accuracy of the diagnoses and medical suggestions provided within the app, especially in offline scenarios where direct connectivity to healthcare professionals may be limited? Like basically, this is a question about generative AI has some limitations, right? Sometimes it may not give us accurate results. Like sometimes it works well, but sometimes it makes mistakes, right? Like a human being.
Yeah, sure.
So basically, the question is about how are we going to ensure accuracy or reliability of the data that we are providing, the medical data, because it's sensitive. People can make some health decisions based on what we provide, right? So how are we going to ensure that it's going to be accurate? That's the question.
So my approach to that would be to work with doctors, I mean specialists, something like that, so that they can validate the accuracy of the, yeah, I would say accuracy of our machine learning algorithm, so that when the user is creating his account, we can advise him or notice that the accuracy of our current implementation is up to this percentage. If you have access to internet, we suggest you to book an appointment, but if not, then you can use the offline solution. But maybe we'll fix our model accuracy for some to something like uh, 95% or 97%, so that it can be as accurate as possible, but validated by professional expert in that the field.
Okay. Like 97%. Very nice. That's a thoughtful approach to ensure the accuracy and reliability of the diagnosis and medical suggestions within your app. Collaborating with doctors to develop and validate the models can indeed help maintain a high standard of accuracy with a target threshold of 97%. Further understand your strategy. Could you explain how you plan to involve and engage healthcare professionals in the development and validation process of diagnostic models? Like, how is this collaboration going to happen? Like, are you going to make partnerships? Do you already have connections with some doctors?
So the way I think about that is we have mainly two categories of professional: those who work in public sectors like public hospital, and those who work privately. So for those working privately, we'll mainly provide them with more customer. I would say I'm saying customer in this uh, uh, case, but it's like patients. They will have access to more patients that they can get more revenue, something like that. But for public sectors, those working in public sectors will help the government covering more area in their respective
Mhm.
country. So yeah, I think that's the two idea I have right now.
I see. So you are actually telling us about how this is going to provide value for the medical people. They would be incentivized to work with us because of, indeed, at the end of the day, this can bring more patients to them, like the ones that are using our system, right? They can get connected with those doctors that are more living in the industrial area. In the future, we can open such connections. And plus, like those people also want to help for healthcare reasons, right? Like they want to help public to get better service. So they would be open to collaborate. And here in the
Yeah,
question, it's also asking like how like the details kind of the collaboration. Like I would say, we collaborate with the private and public hospitals. We will learn from their data records, right? Like they are already collecting some data about their patients. This will help us to train the models. Then we will make the models used get used by the doctors to measure their accuracy in real world environment. When we clearly see that they reach over 97% accuracy with statistical confidence, and doctors' approval, we'll first deploy in areas where internet connection is available. This way, even if there are some issues, we can check accuracy with doctors as well as other ML models through sending the patient data to servers and assign doctors. Once the metrics look good enough, we can deploy our solution in offline environments. So I have made some addition, like basically to make the plan step by step. We can start with the first doctors, right? Instead of giving the recommendations to the patients, we can first give the recommendations to doctors and collect data from them. Is this accurate? Is this not accurate? And based on that, we can actually measure during development how great our models are. When the doctors are like, hey, this is good enough, you can actually start using this on the patients. We can first start with users who are already connected to internet so that we can do tests like whenever we make a recommendation from the offline model. This can be validated with the online model, which is larger, more accurate. And the same query can also be sent to a doctor. And the medical doctor can also check whether the recommendation is good for the given case or not. And once we have also in the online environment great results, we hit our accuracy bar. Then, and we get the, let's say, on, agreement and approval of the medical institutions. then we can start deploying this in the offline environment. So this way, like step by step, we can increase our area of influence and finally make it reach the offline environment. And we can confidently say that our models are at least going to have decent amount of accuracy. It's great to hear about your comprehensive approach to involving healthcare professionals in the development and validation process of your diagnostic models. Leveraging data from private and public hospitals, training models, and then testing them in real world scenarios with doctors' oversight is a robust strategy to ensure accuracy before deployment. To gain a clearer picture of your implementation plan, could you elaborate on how you intend to address any potential challenges or limitations that may arise during the deployment and testing phases, especially in areas with limited internet connectivity? Tim, I won't go into details here for the sake of saving time. So again, these models are not perfect, right? And sometimes you may want to change the direction by, let's say, making an intervention. And we can say, let's not dive into details of solution for the sake of time. Let's move on based on the pitch deck template. The next step. All right, so next is market opportunity. And do we know which market that we want to target at the beginning?
All right.
Yes, Arman.
So yeah, let me understand. I am academic person to provide insight to the greatest state of Okay, so I'll take my country for instance. Access to healthcare is mainly available for people around Cotonou. Cotonou is a city. Cotonou, Abomey, Calavi, Kodome, and so forth. But
Is it written
for
like this?
people
Cotton?
with C instead of K.
With C. Okay.
All right.
So we're going to go ahead to our research and we're going to finish. We have 2,000.
Yes.
But
And
from people in north of Benin, something like that, it's very difficult to have access to healthcare service.
it is difficult to get the service, get healthcare access. Okay. And how many people do you think are living in those areas?
Actually, they have some hospital. It's not like there's absolutely no hospital, but it's very difficult to get access to those. So most of the time, if something happens, they will do their best to get access to the closest hospital. But if something happened, like if this is an emergency and something happened, they do with that actually because they don't have any choice.
Got you. And like, how many people do you think are there like living in the north of Benin? How many people do you think at the moment are in the offline areas that are going to get benefit from this product?
Um, Actually, it will be like at minimum half of the population of Benin because health accessory is available for people around the south of Benin. So for the north, I will say around the half the population in Benin.
How do you plan to ensure? Mhm. Got you. That's a great start point to focus on Benin, especially target areas with limited healthcare access like the north. By identifying half of the population as your target market, you can tailor your solution to meet their specific needs and challenges. Conducting market research in those regions will help you better understand demand and preferences of the target population, allowing you to refine solution accordingly. It's essential to engage with local communities, healthcare providers, and stakeholders to ensure the success and impact of your initiative. Okay, now let's continue. All right. Let's continue with the next step. Don't forget, your task is to get information from us. Us can pitch deck. Continue. Getting more information about different slides.
So we could have marketing side, have social learners, universities, kids, the teams, the directors, the stocks, so there's marketing strategy is going to be.
Okay, so now like it's giving us instructions how we can actually prepare our presentation slides. So let's say, could you please prepare the slide content with the information you got from us? So right now, like it has prepared some content to us, and like this is plenty of textual information for an attractive presentation. At the same time, if we put this together in a nice format and like do some, let's say, shortenings in the bullet points, this can actually do the job. So let's see. In the problem statement, what we have. Many regions in Benin, especially the north, face significant challenges in accessing healthcare services. Limited facilities and resources in the north result in difficulties for residents to receive timely medical care. The disparity in healthcare access negatively impacts the well-being and quality of life of the population in these underserved areas. So, like for the problem description, I would say this is doing a decent job based on the information that we have provided. And again, let's not forget, good can always be better. So the second slide is about the solution. And the title is Innovative Healthcare Access Solution. Our solution aims to bridge the healthcare access gap in the north of Benin by providing a comprehensive platform for appointment scheduling and offline medical assistance. Features include a user-friendly interface for booking appointments, accessing medical resources offline, and connecting with healthcare providers remotely. By leveraging technology, we empower individuals in underserved areas to receive the care they need, improving health outcomes and well-being. So one thing that I'm going to add to this part is obviously like the second aspect of the solution you mentioned, which was about providing access points, public access points. This is a very important part of the solution. And as you see, currently, it's not included. Like I am very happy that we are actually getting to such cases because for us to understand the current state of generative AI, it doesn't always do the right thing with one prompt. So we can have a conversation, we can provide feedback, and based on our feedback, it's also going to improve its performance. So let's also take a look at the market opportunity before we provide whole feedback. But now for the solution, or like let's go one by one. Like for the problem statement, we can say that Benin is where we want to start from, but we know that this is also affecting a lot of people in other areas of Africa. This is not only specific to Benin. We have many countries in which, in some areas, people have difficulty having healthcare access in Africa, unfortunately. So the first feedback point is The problem, okay, we want to start from Benin. At the same time, the problem applies on other parts in Africa. And let's continue. And the second is one of the important aspects, or one important part of our solution is providing public. We were calling access points, right? So that people can come. People who don't have access to internet can come and get appointments and online healthcare.
Experiencing leading the software engineers, someone who will organize it. Yeah, but we're not doing so well, right?
And like on the third one as well, for the market, this is focused on the underserved regions of Benin for the start point. I think this makes perfect sense. Okay. Then we can say, please apply this feedback.
So our question should be
Please apply this feedback to improve.
it actually depends on just trying to reach for 6 years like games so for universities.
Yes. Now let's take a look at the problem statement. Many regions across Africa, including Benin, face significant challenges in accessing healthcare services. Limited facilities and resources in underserved areas results in difficulties for residents to receive timely medical care. This disparity in healthcare access negatively impacts the well-being and quality of life of the populations in these regions. So in the second solution part, we also see public access points addition. By providing physical locations for healthcare services, we ensure that even those without internet connectivity can benefit from our innovative solution. So as you see, like with feedback, we can also improve the content. So we have a limited time. Therefore, I'm going to ask you to continue with the next slides. Can you fill out the next slides as well? We are running out of time. Please give us the continuation of the presentation based on the format we passed earlier. Don't forget, you should write the content, not a guideline, to prepare the content of the slides. Thanks. But basically, like the scientists and machine learning experts, they say it makes no difference to be kind, but it's nice to be kind. Yes, so let's see what we have. Implementation plan. Establish partnerships with local healthcare providers. Develop a mobile application for easy access to healthcare services. Train local community health workers to provide basic healthcare services. Set up telemedicine services for remote consultations. This actually makes very good sense. And when we look at the market opportunity, over 60% of the African population lacks access to basic healthcare services. This is huge. The healthcare market in Africa is projected to reach $100 billion by 2030. That's big number, guys. And our solution targets underserved regions with high demand for healthcare services. So when we take a look at the revenue model, premium model for basic services, subscription-based model for premium services, revenue sharing with local healthcare providers, and potential partnerships with insurance companies. Like I would say, in Africa, in many places, people are not very used to pay for software. So I'm not sure if the first two models are going to be successful. But revenue sharing with local healthcare providers makes sense. And maybe in the future, potential partnerships with insurance companies, because preventive healthcare would be in their favor. They don't want people to get sick very often. And for that reason, those two make more sense for the given circumstances. Let's take a look at impact and sustainability. Improve healthcare access for millions of people in Africa. This is amazing. Creating job opportunities for local community health workers. This is also very good contribution. And sustainable business model with potential for scalability. Well, like this is a claim. It really depends. Once we dig into the business model, if it is strong, then we can potentially say, yes, this is sustainable and scalable. But this is too early to say that. And long-term goal, reduce healthcare disparities and improve healthcare outcomes across Africa. This is a very good mission. So next slide, like the milestones. Pilot the solution in a selected region, gather feedback from users and healthcare providers, iterate on the solution based on feedback, and scale the solution to other underserved regions in Africa. So these are very high-level steps, Steve, obviously. And it didn't bring us, I would say, our call to action. So we can ask, as I said, it makes mistakes from time to time. So let's ask our call to action to another model. Let's go to Mistral, or let's go to Cloud. Let's say. Can you also give us the content of call to action slide? Apparently, we haven't switched the model. We had an issue team.
Has the potential to become getting back. So you can actually
Let's go our home to see.
how
We are going to see our recent chats. Yes. Yeah. Okay, for the sake of completeness, team, let's ask, can you give us the content of the call to action slide? Finishing. That was good. So let's get back to the main room. All right, team, can you guys hear me in the meeting room?
Hello?
Yeah, we can hear you.
Excellent. In that case, team, let's get started with demonstrations. So our mentors, who wants to kick us off, who wants to tell us about their journey and show us what they have come up with the help of generative AI models for the pitch deck content. Any volunteers, team? Yes, our head of academy, Philip Zevdo.
Yeah, sure. Hi guys, my name is Brooke. So basically for us, try to share my screen. Give me a second. For us, what we did first was go to ChatGPT, and we explained. First, we discussed on what problem to attack in our pitch deck, and one of our members came up with the idea that most students don't know how to make the decision when joining a subject or a field of study, because trends are forever changing, right? You don't know in 5 years which department is going to be the most beneficial in terms of success, employment rate. So he wants to do data analysis and provide our customers or clients with predictions and provisions on which jobs are going to be trending in what year, right? That was the problem statement that we started from. And then we explained it to ChatGPT. We told it what we're trying to achieve. When we gave it the content structure for our pitch deck and the content generation, obviously ChatGPT is good at that. And we kept refining it, asking for more. At some point, it was generating names for our platform, and we were trying to choose from 15 names. I can't find it now. Yeah, this one. And we went with future focus by the end after discussing among the four of us. And then after we finished the discussion, the content generation, we also were asking it to do market research, computer analysis, who are relevant for our cause, right? After doing all that, we went to Canvas. And I think we only got started with the first 2 or 3 slides, at which point the timer ended. But yeah, I mean, that's all. I think we got the gist of what we are supposed to do. And that was our experience.
This is excellent, Bridget. I believe you guys made a very good progress. Like in our group, we couldn't come to the preparing pitch deck. Like we were still working on the content. We had some back and forth with ChatGPT, but it was really nice to see your journey. This is really great. And maybe someone who was a part of Biruk's session, like, can you please share with us, like, what kind of journey was that? Was this helpful? Like, did you use ChatGPT that way before? Can you tell us more about how did it go? Yes, Alpha. Or Biruk, maybe you can introduce us some of your teammates.
Yes. Yes. So with me, I think we were 4. It was Lionel, Gerald, and Yusuf. So let's go with 2. Yeah, okay. So maybe Lionel, you can walk us through the experience. You can unmute yourself. Yes, Leonid, go ahead. So Emery was asking how the experience was in terms of the in terms of the idea generation with ChatGPT, and if you ever have used ChatGPT to do that before.
Yes. Thank you. That was a good experience with my collaborator. Firstly, we find the problem. Some problems is very relevant in the field of young girls and employmentship and scholarship. We remark that there is no bridge. There is no really bridge, specifically in Africa and West Africa. So we know with GPT we have to discuss to know more, to understand more deeply what problem we have, and he helped me to get a real path, real roadmap to build our solution. I think that there can be many future in that. Thank you.
Yes, guys. So I think with the boom of generative AI, we don't use it enough. It's not like the old days. You don't have to do market research by your own. Normally, this will take days, if not weeks, to complete one pitch deck, and it will take a team of people to do it. But with ChatGPT, you have a vast amount of knowledge at the tips of your fingers. So make sure to utilize it if you're not already doing so. But yeah, that was our experience with me and my team.
Thank you very much, Biruk. And who is the next team who want to share their experience with us? Maybe we can have 1 or 2 more teams. All right, Nati. Maybe let's continue with you, and after that we can conclude with Rediet.
All right. So thank you. So me and my team, we were discussing about building, like solving the problem of education in Africa. And actually, it was education, but not really related to the students, because we thought of the problem that the universities are facing. So universities have a problem setting up servers and launching their portals and maintaining it as well. So we came up with this idea of let me share my ChatGPT screen. We came up with this idea where we have a centralized platform for the setup of their portals, and universities would have like just 5-6 clicks, and then their portal is up and running, and they could invite their students
and they could manage how they share their resources. And first off, we were like trying to brainstorm some names, and we came up. The ChatGPT generated some names for us, but one of my teammates, Future, has actually came up with a really good name. It was a uni gateway because it's for universities, and it's a gateway, it's a portal, and we used that. And for the problem statement, we stated that the inefficient resource management for universities, because most of the time their portals are not do not have high traffic, and they're just sitting there. The servers are not handling too many requests. And at some times when there are seasons where the students get their results, it's very crowded, and the servers actually uh, have difficulty coping up with the demands. And we stated that as our problem statement, and we went over to the solution, and we had an idea of like our solution would be quickly setting up their servers, and like it enhances the experience of the universities. And we also had a really good insight on how we could make this idea a business idea, and we thought of charging the universities. We would have a marketing team going around universities in Africa and like talking to the leaders, and having a business out of it. Yeah, and we had a really good session.
Nice. Thank you very much, Nati. And do you have any teammates who want to share their experience with us?
Yeah, we have Future. Future was one of my teammates.
Future, how did the session go for you? Anything you want to share with us?
He was actually having mic issues there during the session.
Got you. All right. Are there any other teammates that you want to invite to the stage? Or shall we proceed to read it?
Yeah, let's proceed. I think he wrote his experience, Future. The experience was great. I learned a lot.
Beautiful. Thank you very much. And next up, Radiant.
Okay, thank you, everyone. Yeah, so for me and my teammates, we started the session with brainstorming some ideas that we could apply for our pitch deck. So, okay. For our pitch deck. So for the ideas, two of my teammates, they came up with two kinds of ideas. So the first one was the crop detection using AI algorithms, so that farmers could easily detect diseases on their plants and mitigate them. And the second one was some kind of greenhouse, but for the greenhouse part, the part that we would do is automation on the climate control, because when people like grow plants outside of that greenhouse, there is a lot of unfavorable climatic conditions such as heavy rainfall. But in that greenhouse, we can easily automate the climate. So there were these two ideas generated by our two teammates, but we merged these two ideas. So in the greenhouse, what we do is in the greenhouse, what we do is we use the crop detection system as well as the climate automation system, the climate control automation system. So, can you see my screen? So yeah, for ChatGPT, we just explained our idea that we're thinking of a crop disease detection system, and also inside that greenhouse, we are also planning to automate our climate control mechanism. So the ChatGPT gave us AgriGuard, which is smart solutions for crop health and climate control. This was the title it gave us, and it gave us a tagline. So we started with this. We just talked how to use ChatGPT to generate content based on what we give him or give it. So we demonstrated this, and then we give it before that, we divided certain parts of the content and tried to use ChatGPT to generate content. So most of my teammates, they generated parts of the content, but I also generated the whole content here as well. Maybe my teammates can also share their experience here if any of them are here. So yeah, I see Kotsu. Kotsu is from Lesotho too. So Kotsu, can you share your experience in the session?
Yes, I can. Okay. In the presentation. Okay, I'm sorry. Let me just do this. Okay. In the preparation of the pitch deck, my main task was to deal with the business model part of it. So in dealing with the business model part of it, what I have looked in is how can I be able to reach the farmers who will be using this system. So I thought that maybe we can provide or reach the farmers by either three ways. The first one being selling the products where the farmers can buy the whole system, or the other one will be renting the system to our farmers where they can rent a particular system for maybe a certain period of maybe let's say 6 months. And then another way will be sharing, like if the farmers has produced this much yield, we will be able to share the yield, that say that 30% and 70%, so that each and every farmer can be able to use this system very easy, can access this system and use it very easily. So that's how one of the things that I was looking into, so that the system can be able to sustain itself. Thank you.
Thank you, Kotso. So I think that concludes the experience from my teams.
Thank you very much, Retiet. So before we finally see like another tool and close, any questions, any other points, team, you want to raise, any other experience sharing you want to make? Okay, if there are no other points, then let me also share my screen. Because in the meantime, what I have done, I have actually brought our deck content into presentations.ai. So basically what I have done, so we actually used AfroChat. This is one of A2SV projects, which provides access to different GPT models, like from different companies, like for people who are in different breakout rooms. Like you can see that you can choose which model you want to interact with. So after our session finished, I basically gave it one more prompt to bring us the call to action as well as the full presentation content at once. And then I gave it to presentation AI. And this is what has come out. I didn't take a look. All I did is just bringing the content and giving it to presentations.ai. So now let's take a look what it came up with. Again, I haven't seen it before, team. We will all see the magic of AI together. Bridging healthcare disparities in Africa. Like we didn't choose a title for our presentation. And this is what it come up with. Other teams had that discussion. I really appreciate. We forgot. So what are the problems that we have seen? Lack of access to quality healthcare services in Africa, limited resources and infrastructure, and healthcare disparities, especially in the these are resulting poor outcomes. And like our member who has suggested this idea was from Benin. Therefore, our focus was more on Benin. And the current situation in some areas, limited healthcare facilities, high infant mortality rate, and prevalence of preventable diseases. There are some preventable diseases, but lack of healthcare services are making trouble. And this is actually was not part, the last two were not part of our discussion, but when we asked to prepare concise content, they came out. And for the solution implementation, what we are going to do is establishing partnerships with healthcare facilities so that we can develop models with doctors and utilizing the data that is available in those hospitals. And developing a mobile app because we want to bring ease of access to healthcare services. And we are going to train community health workers that are going to work in the public access points and implement telemedicine services so that when people reach to these points, they can actually get help from medical professionals. So when we look at the market opportunity, around 60% of the people in the continent access, have lack of access for basic healthcare services. This is huge. And it is expected for the healthcare market to grow to $100 billion by 2030. And our targets is actually underserved areas because there is a higher demand for essential healthcare services in those areas. So in the revenue model, we had our discussion on this. I would say this is very strong. Like we should all know that GPT is not the cure for everything. And by working on it together, we can improve the content. Like we were spending more time focusing on problem and solution. So for the last parts, we didn't actually have, let's say, the iteration that we need to have to make it more robust. But in my personal opinion, like revenue sharing and partnerships with insurance companies, they seem more realistic than a freemium model or subscription-based model for people who are living in especially rural area where they don't have internet access. So, like in this slide, we can see what kind of impact it's going to make to people. Again, I'm not going to take much time for the sake of using time efficiently. So when we take a look at the next steps, there is going to be a pilot in a selected region. And apparently it also skipped our call to action content. As I said, I didn't have a chance to check. But team, like as we can see in minutes, this can actually give us a very good point to play with and make it even more robust. Like in the past, putting together such kind of a presentation probably was taking a lot more time, like at least hours. But now, with the help of AI, creating the content and creating, I would say, visually appealing presentations definitely are easier. And again, let's not forget our lesson today. Good can always be better. Like we didn't have enough time in this workshop to make these presentations very robust. But you're not supposed to finish your pitch deck in 30 minutes. Obviously, you can take more time. So the idea was to show you what is possible, what kind of tools are available out there. And with the help of those, we can actually prepare high quality outputs that are going to help us to proceed in this journey of taking ideas from the ground and making them real world solutions. Team, I hope you enjoyed and you learned because at A2SV we try to make both of them together. Thanks for your time. Thanks for your attention. And I want to particularly thank to our organizers, Beyimnet Bekele, who is running the whole hackathon show, as well as Zelala and other mentors who made themselves available to help other fellow African technologists. This was really nice. Thank you very much. And always remember, good can always be better. Don't be satisfied with the output. Make iterations, make it better and better. Thank you, team. See you. Oh, before we close, are there any questions? I see Terian, your hand is raised. Okay, any other questions or points, team? All right. If not, please take care and see you in the other workshops. Bye.